Anacin Tablet is a combination of aspirin and caffeine. It is used to treat minor aches and pains such as headache, toothache, menstrual cramps, or muscle aches. Aspirin is known as a salicylate and a nonsteroidal anti-inflammatory drug, NSAID. It helps to relieve pain and decreases swelling. Caffeine may help to increase the effects of aspirin on pain. The recommended dosage for adults is 2 tablets every 4 hours as needed, with a maximum of 12 tablets in 24 hours. It is important to take Anacin with a full glass of water. It is best to take Anacin with food to help prevent stomach upset. Before taking Anacin Tablet, make sure to read and follow all the directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, take it as directed. Take this medication by mouth as directed by your doctor, usually every 6 hours. If you have stomach upset, take it with food or milk, and drink a full glass of water unless your doctor directs you otherwise. Do not lie down for at least 10 minutes after taking this medication. If you are using the powder packets, dissolve the powder on your tongue and follow with a full glass of water. The dosage is based on your medical condition and response to treatment. Do not increase your dose or use this drug more often or for longer than directed. This medication contains caffeine, so avoid drinking large amounts of beverages containing caffeine, eating large amounts of chocolate, or taking non-prescription products that contain caffeine. If you are taking this medication for self-treatment of headache, get medical help right away if you also have trouble speaking, weakness on one side of the body, or sudden vision changes. If you are taking this medication, as needed, remember that pain medications work best if they are used as the first signs of pain occur. If you wait until the pain has worsened, the medicine may not work as well. You should not take this medication for self-treatment of pain for longer than 10 days. You should not use this drug to self-treat a fever that lasts longer than 3 days. In these cases, consult a doctor because you may have a more serious condition. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. Some common side effects of Anacin Tablet may include nausea, vomiting, stomach upset, heartburn, trouble sleeping, or increased urination. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. It's important to remember that if your doctor has prescribed this medication to you, they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to seek immediate medical attention if you experience any serious side effects, such as changes in mood, trembling, irregular heartbeat, hearing changes, easy bruising, signs of kidney problems, severe or persistent nausea/vomiting, yellowing of the eyes or skin, dark urine, severe abdominal pain, or signs of serious allergic reaction. These side effects are rare, but it's important to get medical help right away if you notice any of these symptoms. If you experience any other effects not listed here, it's important to contact your doctor or pharmacist. When taking Anacin Tablet, it's important to follow the recommended dosage and take it at the optimal timing for the best results. Always consult your doctor for personalized advice regarding the use of this medication. It is important to discuss with your doctor or pharmacist if you have any allergies to caffeine, aspirin, other nonsteroidal anti-inflammatory drugs, NSAIDs, or other salicylates before taking Anacin. It is also important to share your medical history, especially if you have stomach problems, asthma, nasal polyps, bleeding or blood clotting problems, gout, heart problems, high blood pressure, kidney or liver disease, or certain enzyme deficiencies. If you are planning to have surgery or certain medical procedures, it is important to inform your doctor or dentist about your use of this medication and any other products you use. Anacin may cause stomach bleeding, and the combination of alcohol and tobacco with this medicine may increase the risk of stomach bleeding, so it is advisable to limit alcohol and stop smoking. It is important to note that children and teenagers younger than 18 years should not take aspirin if they have certain illnesses, and older adults may be more sensitive to the side effects of this drug. Women of childbearing age should discuss the benefits and risks of using this medication with their doctor, especially if they are pregnant or planning to become pregnant. Anacin should not be used after 30 weeks of pregnancy and is not recommended for breastfeeding mothers. Drug interactions can change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Anacin Tablet include acetazolamide, corticosteroids, methotrexate, valproic acid, and herbal medications such as ginkgo biloba. Before using this product, consult your doctor if you have recently received certain live vaccines. This medication may increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. Check all prescription and non-prescription medicine labels carefully, and ask your pharmacist about using these products safely. Daily use of NSAIDs, such as ibuprofen, may decrease aspirin's ability to prevent heart attack or stroke. If you are taking low-dose aspirin for prevention, consult your doctor or pharmacist for more details and to discuss other possible treatments for your pain or fever. It's also important to note that this medication may interfere with certain medical/lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. If someone has accidentally taken too much Anacin and is experiencing severe symptoms such as fainting or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. Symptoms of an Anacin overdose may include burning pain in the throat or stomach, confusion, changes in mental or mood, fainting, weakness, ringing in the ears, fever, rapid breathing, changes in urine output, seizures, or loss of consciousness. It is crucial to seek medical attention promptly if any of these symptoms occur. Do not share Anacin Tablet with others. If you are using Anacin Tablet for a long time, your doctor may need to do lab and/or medical tests to check for side effects. It's important to keep all medical and lab appointments and consult your doctor for more details. Because Anacin Tablet contains caffeine, it's best to avoid taking it close to bedtime as it may make it difficult to fall asleep. It's also recommended to limit the use of other caffeine-containing medications, foods, or beverages while taking Anacin Tablet. Consuming too much caffeine may cause nervousness, irritability, trouble sleeping, or a fast heartbeat. If you are using Anacin Tablet for headaches, it's best to avoid certain foods that may trigger your headaches. Making lifestyle changes such as stress reduction programs, exercise, and dietary changes may also help prevent headaches. Be sure to talk to your doctor or pharmacist about lifestyle changes that might benefit you. If you are taking Anacin Tablet on a regular schedule and miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Take your next dose at the regular time. Do not double the dose to catch up. It's important to store Anacin tablets at room temperature, away from light and moisture. Make sure to keep them out of the bathroom and away from the reach of children and pets. When it comes to getting rid of expired or unused Anacin tablets, it's best to consult your pharmacist or local waste disposal company. Never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.